April is Donate Life Month, and those who are organ donors help to give sight to those in need. Dr. Christina Gilmore from the Wolfe Eye Clinic joins us to talk about how donations of corneas help them help others. Thank you so much for being here during Donate Life Month.
Hi, thanks for having me.
Well, a lot of people might not think of organ donation as helping others with their sight, but tell us about cornea donation, what that is.
Sure. So the cornea is the clear window over the front part of the eye, over the colored part of the eye. And it's meant to be nice and crystal clear so that you can see through. There's many different eye conditions that can cause it to become blurry, and those can be very debilitating for patients. And the cornea is actually the only part of the eye that we are able to successfully transplant. So we rely on generous donors throughout the community who offer up their eyes as donations so that we can give new sight to patients who have lost their vision for one unfortunate reason or another. It can be very life-changing for them.
Oh, definitely. And can you tell us more about the role Wolfe Eye Clinic plays in cornea transplants?
Sure. We have a surgery center, and as a cornea surgeon, we evaluate the patients in clinic. We can tell what part of the cornea is diseased or failing, and then we're actually able to selectively transplant that portion, whether it's the front, the back, or the entire cornea. And then we sign those patients up for surgery, and they wait for a generous donor, and we get donations, largely from the citizens of Iowa helping out their fellow Iowans. And then those corneas come to us from multiple systems working through the Iowa Donor Network, as well as the Iowa Lions Eye Bank plays a huge role in getting us our corneas that we're able to transplant for the patients on the day of surgery.
And you've seen how life-changing this can be for patients, right?
Absolutely. You would be amazed, and patients are so appreciative, and to their donors and to everyone who makes it possible. It's hard to imagine having poor vision, but when you see a patient struggling, they're not able to do things they want to do. They're not able to, drive or spend time with their family, and it can be very life-changing gift for them.
And what other procedures do cornea specialists like yourself perform or do to help patients?
Sure. We see patients in many capacities. Of course, do cataract surgery, also do surgery to remove cancers on the front of the eye. So any surgery involving the outside of the eye would be in my purview. We see trauma. So sometimes people have trauma or accidents that involve the cornea. They may or may not benefit from a cornea transplant, that sort of thing.
Well, Dr. Gilmore with Wolfe Eye Clinic, thank you so much for joining us to talk about this during Donate Life Month. My mom was actually an organ donor and donated her corneas as well. So it means a lot to the families, I believe, as well.
Yeah, it's surprising. Some people, even if you're not able to donate a different organ for one reason or another, the eye is actually an immunologically privileged site. So there's no blood vessels. And a lot of patients don't realize they can still donate their eyes and make a great gift. So thanks to all of those who've done so, and for future donors as well. And thanks for having me.
Well, thank you again. And you can learn more about the services offered at Wolfe Eye Clinic by going online to wolfeyeclinic.com or by checking out their social media pages. You can make an appointment or ask questions by calling 833-474-5850. Wolfe Eye Clinic is located at 6200 West Town Parkway in West Des Moines.